welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist I have provided almost all the topics in a very systematic order. It is very convenient for the continued study. Thank you very much. You can visit it that also. Now in the last few classes we are discussing about short stature. So many case studies also we have seen. Growth charts also we have seen. So now as far as short stature is concerned, some of the nomenclatures that we have to understand, definitions and as well as nomenclatures. So that we will discuss in this class. When we talk about short stature, there are many ages, like chronological age. A term comes chronological age. There is a term called as height age. There is a term called as weight age. There is a term called as bone age. Now we need to understand what exactly this is. The chronological age. So chronological age means from the birthday to till date. That age is called as chronological age. If I am 10 years of old, then 10 years is my chronological age. I am of chronological age of 10 years. That's very that is very simple. Now what do you mean by height age? Age at which the height becomes 5th percentile. Okay, the age by which, age in which your height reaches minimum of 5th percentile. Minimum of 5th percentile. So that is actually called as height age. That's called as height age. Then what is the weight age? Age at which the weight reaches the 50th percentile. So that is called as weight age. That is called as weight age. Now what do you mean by bone age? Bone age means what age which corresponds to the ossification center of the bone. So we have got different ossification centers in the different bones. Okay. Now the activity of this ossification center, they corresponds to what age? Ossification center usually get activated at a particular age. Okay. In the different bones we have got different ossification center. Okay. How these ossification centers are actually activated. That means, suppose you mean to say that a particular ossification center present in the bone, so that will go into activate in the 10th year of life, suppose. Okay, and the bone growth starts. Now, what is the current status of that particular ossification center? Before 10 years only, if the ossification center is closed, or at the age of 10th year, that particular ossification center is still active or open. There is a scope for the further increase in the height. So that we have to understand. Okay. So bone age means a age which corresponds to the ossification center in the bone. Now, come to the very important part, that is bone age assessment. See, bone age assessment is also called as skeletal age. That means skeletal bone age. Now, X-ray of the left wrist and hand is universally followed. To assess the bone age, usually we will go for the X-ray of the left wrist. The right wrist, usually most of the kids are right-handed people, so they are doing more activity from the right hand. So maybe bone age may not be so precise, but in the left hand, usually we will do the less work. So the X-ray of the left wrist and as well as hand is universally followed. There are many methods of bone age assessment like. So how to assess the bone age assessment? Tanner's White House method. This is called as Tanner's White House method. This is one method. Then Gerlich Pillay Atlas. So that will be followed. Atlas will be there. Different bone age groups. We need to compare our X-ray. Okay, X-ray which is taken left wrist and as well as hand. So that will be compared with that figures which is given in the Atlas. And then we will say, compared to this, in comparison to this, at what particular age is there in this X-ray. Then Gilson and ratio method is followed. Bone Experts is a software actually. Bone Expert software. This is a software. You need to feed your X-ray. You need to feed your X-ray in that software, and it will give the result at which particular bone age is there in this particular bone, which is shown in the X-ray. Okay. Very less error marks are there. Okay. So Bone Expert, a software method can be used. Gilson and ratio method previously used. Gerlich Pillay methods can be used, or Tanner White House method can be used to assess the bone age assessment. When bone age measurement is significant, what is the significance of this bone age measurement? So that we have to understand. If the bone age is more than 1 year compared to that of the chronological age, suppose chronological age is 10 year, you take it granted, okay. Now bone age is of 11 years. बोन एज जो दिखा रहा है, बोन एज दिखा रहा है कि इसका 11 साल, बट आपका जो एज है वो क्रोनोलॉजिकल एज है, वो 10 ईयर्स है. अब क्या होगा? सो सपोज द चाइल्ड एज इज 3 years. सेम एग्जाम्पल आई एम गिविंग हियर ऑल्सो. चाइल्ड एज इज 3 years, क्रोनोलॉजिकल एज इज 3 years, एंड द बोन एज इज 2 years. बोन एज कम है, एक में ज़्यादा था, एक में कम है. बोन एज इज 2 years, देन इट इज सिग्निफिकेंस. ओके, आपका क्रोनोलॉजिकल एज के हिसाब से आपका बोन एज नहीं है, वो कम है तो सिग्निफिकेंट है. आपका क्रोनोलॉजिकल एज के हिसाब से आपका बोन एज ज़्यादा है तो भी सिग्निफिकेंट है. नाउ इफ़ द डिफरेंस इज 1.5 years, क्रोनोलॉजिकल एज और बोन एज में जो डिफरेंस है, इफ़ इट इज़ 1.5 years, इट इज़ ऑलवेज सिग्निफिकेंस इन चिल्ड्रन. ठीक है, 1.5 years का जो सिग्निफिकेंस है बोन एज और क्रोनोलॉजिकल एज में डिफरेंस है, दैट इज ऑलवेज सिग्निफिकेंट. दिस रूल इज फॉर 4 to 12 years. Between 4 to 12 years, if the difference is 1.5 years, then it is significant. If the difference is more than 2 years, then it is significant in more than 12 years. 12 साल का ऊपर का जो बच्चों में अगर ये डिफरेंस 2 साल का है तो ज़्यादा सिग्निफिकेंट है. 4 से 12 साल तक डिफरेंट 1.5 का है तो सिग्निफिकेंट है, उससे कम है तो कोई ज़्यादा सिग्निफिकेंट नहीं है. वॉट एवर मेथड यू डू, never do by the carpal bone calculation. So usually bone age should not be followed or done by using the carpal bones. Carpal bone calculation में आपको नहीं जाना है. फर्स्ट ईयर में एक carpal bone रहेगा, सेकेंड ईयर में 2 रहेगा. So there's a rule is there, okay, thumb rule is there. So it is told that it is not so precise. इससे कंफ्यूज हो सकता है, मिस भी हो सकता है. So this is not a good method. You go by other methods. Now in a short stature child, the bone age may be normal, it may be delayed or it may be advanced. शॉर्ट स्टेचर का बच्चा हमारे पास आएगा तो हो सकता है कि उसका लेंथ तो कम है, लेंथ तो कम है और बोन एज भी कम है, ये हो सकता है. लेंथ कम है और बोन एज नॉर्मल है, ये भी हो सकता है. लेंथ कम है और बोन एज जो है ज़रूरत से ज़्यादा है, एडवांस्ड है. ओके, सो एडवांस्ड बोन एज इज यूजुअली सीन इन केस ऑफ हाइपोथायरॉयडिज्म or euthyroid state, etc. Now this detail we will see now. Now if we are plotting on the chart, then 2HD or more or below or above the mean is significance. Bone age को एक चार्ट में आप सिग्निफिकेंट करेंगे if it is below 2HD or if it is more than 2HD or above 2HD, everything is significant. और 20% above और below the chronological age is also significance. जब प्लॉट करेंगे, if bone age is 20% more or 20% less than the chronological age, then also it is significance. By the Tanner-Whitehouse method, when we compare, it is best suited for the Western kids actually, Tanner-White method. For Indian kids, there is 1 year delay compared to the Western kids. And when you are doing this by using the Tanner's method, which is more good for the Western population, and if you are applying the same for the Indian population, there is 1 year delay compared to the Western kids. Okay, so bone age will be affected in almost all the chronic systemic disorders. Okay, it does not mean that a normal bone age will be exclude them. That means usually in all the chronic disorders, systemic disorders, bone age is defected or affected. But even those babies who are not having any chronic disorders also sometimes bone ages get affected. So that we will see. If at all the bone age is normal, chronic systemic disease or genetic disease are unlikely, but it is not impossible. मान लो bone age is normal, इसका मतलब ये नहीं है कि chronic systemic disease not systemic disease और genetic disease are unlikely. Usually bone age अगर normal है तो उसका मतलब है chronic disorder नहीं है और genetic disease नहीं है, ठीक है, और unlikely. But it is not impossible. ऐसा नहीं है कि हो ही नहीं सकता है, वो हो भी सकता है, ठीक है. सो इन द प्रीवियस केस वी आर डिस्कसिंग अबाउट द बोन एज. एक केस हमने देखा था जो वीडियो डाला था. इन द प्रीवियस केस वी आर डिस्कसिंग अबाउट बोन एज इज 7 years and the chronological age is also 7 years. The height is almost all okay or maybe slightly less. So it may be the case of familial short stature. It may be the case of familial short stature. Now we have to come in detail. So these are the basic things. Bone age, agar we are not clear, if you are not clear, it will be clear when we take the examples. Okay. So now let us see the relationship between all these ages. Okay. So bone age, chronological age, okay, height age, weight age. So that we will see in the next class.